If you don't reintroduce foods properly, you're missing 90% of the information the elimination diet can share with you. The reintroduction phase is critical. This is where true insight happens as far as what foods cause symptoms for you. This is highly personalized nutrition and allows you to identify your unique food triggers. Hi, I'm Dr. Kate Erickson, internal medicine physician, registered dietitian, and integrative and functional medicine specialist. So how do you do a proper reintroduction? Step 1, identify the food that you've been missing most. This should be a single food, not a combination food. For example, if you love cheese, don't reintroduce by eating pizza that has gluten, dairy, and other ingredients. Start by introducing a single whole food. For example, a slice of mozzarella cheese. Then eat that food several times during day 1. Observe for any symptoms over the next 2 days. Symptoms might be subtle. It might be worsening fatigue or brain fog, headaches, gas, bloating, joint pains, or skin rashes. It's important to remember that food sensitivities are often delayed. They don't usually happen right away. It may take 2 or even 3 days before you start to have adverse reactions. So that's why it's so important to introduce only one whole food at a time and wait for a response. If after 2 to 3 days of eating that particular food, you have no new symptoms, then great, move on to a second food. Using a symptom tracker can be extremely helpful during this phase of the journey, and working with a functional medicine practitioner can help you gain clarity and insight. If you do have adverse symptoms after reintroducing a food, then simply stop, eliminate that food once again, wait 3 days until you feel well again, and then choose a different food and start the process. The reintroduction phase can take many weeks, depending on how many foods you eliminated in the first place. The biggest pitfalls I see is that people reintroduce combination foods, such as a multigrain bread, granola, a sandwich, anything that contains more than a single food item. This can lead to confusion and frustration because you don't really know what's causing your symptoms. Take your time and go through this process methodically. Again, this is where probably the most insight can be gained. You might find that you have a gluten sensitivity that you never really realized before. Or maybe when you introduce dairy, you have terrible gas and bloating. Listen to that. Your body is trying to communicate with you, and those symptoms are a sign that something is off. You may not need to eliminate these foods forever. It often just means that there's an issue with digestion, absorption, the gut lining, or the microbiome. And these are all areas that can be improved upon through the functional medicine approach. An elimination diet can be life-changing, but not everyone should do it. If you're pregnant, have a history of eating disorders, have unintentional weight loss, you're malnourished, or you have specific medical conditions, you should probably not try an elimination diet. Or if you want to, please seek out a certified functional medicine physician who can walk with you step by step. But for most people, an elimination diet can be a powerful tool, especially those people who have chronic digestive issues, inflammation, fatigue, brain fog, autoimmune symptoms, or just symptoms across the entire body, and you feel terrible. There are a number of resources to assist you in an elimination diet journey, and one of the best resources is working with a functional medicine specialist. This could be a dietitian who's trained in functional medicine, a mid-level or nurse practitioner, or a physician who you're working with to gain deeper insight, clarity, and uncover the root causes of your symptoms. It's important to remember that you don't have to embark on an entire elimination diet. It can be too overwhelming to eliminate gluten, dairy, soy, corn, nuts, peanuts, added sugars, processed foods, alcohol. If you'd like to try this, just start with one food group. The 2 most common food sensitivities that I see in practice are gluten and dairy. So pick 1 or 2 of those food categories and try an elimination diet for 3 weeks. Then carefully reintroduce and watch for any worsening symptoms. You might just find that you feel better when you avoid particular foods. So thanks for watching this series on elimination diets. I hope you found this information helpful. If you're thinking about trying an elimination diet, I invite you to comment below on what are some of your biggest questions, struggles, or symptoms you're hoping to improve. And if you liked this video, please like and subscribe. It really helps others find this new channel. I'm Dr. Kate, and thanks for watching.